Hello, welcome back to Free and Healthy Children International's Coronavirus Nosode Research Review. This is part 2, where we are going to look at dosing, look at active cases, and remedy responses. And we left off in part 1 with an overview of the concepts, which I'm just going to review here before we get into the content of part 2. We'd gone over the circle of disease, and we're going to see that come forward when we're looking at the remedy responses. We had reviewed similar and dissimilar diseases. Homeopathy is a system of medicine that works with similar diseases as a process to cure, and HP can either be similar or dissimilar to the individual based on their susceptibility. A dissimilar disease is one that can enter the body and move through its immunological process and then leave the body with the health unchanged after that, whereas a similar activity would actually cure some component of the individual and move them to a better state of health. We also, in part 3, will be looking at never been well since, the miasm and latent expressions. And we're also going to be looking at, in this section, proving responses, but in part 3 it's going to be relapse, aggravation, and activation. Same with before, during, and after, previous, active, and exposure. Those are some of it we're introducing in part 2, and it's going to go into part 3. And our dosing we've just reviewed in part 1, and would really, hopefully the more data that gets presented, you'll come to agree with us that the nosode is perfect for this epidemic. Yes. So these are our doses. So our dosing directions were to give a single dose on Saturday of 3 pellets. And we chose the 1M potency. I just finished being in India and managed to visit the Central Council of Homeopathy there, and they showed me their research department of one particular hospital where they had been doing some research on nosodes. And they found that, well, with dengue nosode, that in the lower potencies, because we know with dengue, if you've had previous exposure to dengue the second time around, you're more likely to get a hemorrhagic condition. And they found that in the lower than 200 C potency, that giving the nosode in that strength actively caused hemolysis of cells. So in the higher potency, so with that information, because we knew what was happening with coronavirus, it was like, we're going to go with the 1M. And a lot of people had already reported, so you put this in time, back in March and February, giving the nosode that the lower potencies were causing too much of an aggravation. So we started with the 1M. So it was a single dose on a Saturday, and then followed by a week later on Saturday, 3 pellets, morning, noon, and night. And if there was exposure, they were instructed to repeat the dose if needed. Now, questions we have is, are the doses that we gave sufficient? Was it a sufficient potency? And there are many mistakes in answers. So people don't necessarily know how to fill out questionnaires very well. And so we did the best with the information that we have. So we had 796 respondents in the 2-week follow-up, with 793 single and 793 triple doses, with a total of 3,172 doses reported in the 2-week follow-up. Now, in the 3-month follow-up, we can see there was only 434 respondents, but they reported taking many more doses than what we had said, which is fine, because the directions were, if you're exposed, take it, or if the symptoms relapse. And sometimes if the single dose is too strong, it's suggested that you put the dose in water and then sip it for the next 24 hours to kind of smooth that immune response out. So there were a total of 2,104 doses reported from the 3-month follow-up. How many actual doses are given, we don't know, and all of our supervisors were giving remedies without registering them in our research as well. So there's probably 10,000 doses given. We have 70 practitioners and so on and so forth. No adverse events were reported. So then we can just look at these dates. So these are the dates of the dosing. And so this is the single dose, and then the triple dose comes about a week later. And you can see it makes this nice little curve. And we stopped tracking June 24th entrance. Well, we worked very quickly to put this research together. We had all the background skeleton of our infrastructure in order to manage it, because Free and Healthy Children has been around for 12 years. And so we very quickly organized this. Now this chart is really interesting. So look here, that was the first dose was given sometime in February. And this is the peak of the single dose, and this is the peak of the triple dose. So we managed to get our dosing in prior to the wave. So let's look at this chart here for a second. This black line is deaths, and the scale of the deaths is on the left-hand side here, and the orange is cases, so that's testing positive too. And the scale, the legend for that is on this side. So it looks like these intersect, but they do not. The black line is responding over here to the 2000. So then this was our last dose reported, and so you know that we have a bell curve sort of similar to this. And then we sent out a newsletter in October, and we said, please, families, take a triple dose of the last dose that you ever took. And so at that time, some people took a 1M and some people took a 10M. And we were suggesting the 10M sort of over the summer for those who wanted to help transform the epidemic more, to get into the deeper aspects of the psychology. And this green line is when they started the heavy flu vaccine push. So that's just an interesting piece right there. These symptoms on this page come from those who registered who had active acute symptoms. They had been going on, some of them for longer than 2 weeks, 17 of them for longer than 2 weeks. 63 of them had active symptoms, and that could be anything from a headache to a runny nose to symptoms across the board here. Just a few little details. We neglected in our question to ask for prior throat symptoms and prior stomach and rectum, because we didn't believe that it was necessarily a part of the coronavirus picture. But as we came in with all the proving symptoms, these were very, very important. We certainly had fever, body aches, headache, lung, cough, sinus, and then we have our generals and emotions here. One of the main things you're going to see through here is intermittent a lot. You're going to see the difficulty breathing, asthma, wheezing, tingling, fiery. Most of the fevers were very low grade, and this is important to watch as we move through the slides. Medium, a few had high, and one had chills. So on this next slide, what we did is took out the descriptive words, like the verbs. So the verbs that help to describe, we have our location, sensation, and the general feeling about it, and the time. So intermittent recurring is throughout the whole thing. Another is a little bit, slight, small, just a little bit there. Some is also awful, horrible, like that. We've got heaviness, plugged. There's a lot of fatigue noted, deep drowning. So this gives us this tickling, scratchy, tingling is like that little coronavirus in your nose and throat and just bothering. As we've moved through this, we've come up with the understanding that the suggested miasms that reflect this are intermittent malaria and a huge amount of effort and collapse. And I think what we've all been working through is, reconciling. Well, anyways, there's so many different things about how we're living, and certainly doing this research has been a monumental effort. Let's look at the active, acute, same immunological symptoms. Upon registration, that's active. Then after the single dose and after the triple dose, in all of the categories that we just went through. And the cured symptoms are the light colored at the top. There are symptoms that came on and went away. Those are proving symptoms. And then the active symptoms are the ones that were either there to begin with or didn't go away. So you can see as we go through that actually the fever symptoms are increasing. We had, I think it's like 170 or 180 altogether fever symptoms. Some of them went, some of them were cured. But then when you look and see what's happening over here with the sinuses and the cough, as we move through it, there's higher improvement in the sinus and cough symptoms. And also the headache, what happened with the headache. And you can also see the general trend in most of them is the number of symptoms go down from the single to the triple. So what we're doing is we're pushing forward this immunological process. So we have in the beginning all those low fevers. That was a prodromal period. And from our dosing, you can see that it was in a prodromal period. And then we really push it up to the fever. And through that fever, you actually burn out the discharge and you move towards resolution. And so this is also fever and chills. There's more work to be done to tease out all the details. There were 63 people with active symptoms. There were 314 people who had developed symptoms on the single dose, and some of them may have been active symptoms. There were 218 who developed in the triple dose. And then the total number of symptoms, you can see actually the triple is cumulatively just a little less, but I think that's because this fever is right there. And then this is the total number of symptoms that were tallied from all categories as we go through. This is just one person's story. Next day after the triple dose, I woke up with a slight headache. During the day, felt very tired, had to rest, felt chills that came and go throughout the day, and overall felt like I was about to catch a cold. Muscle weakness, felt like I had run a marathon the day before. Highest peak of not feeling well was at noon. Then rested, had coffee in the afternoon, and felt better. I had a really good night's sleep and woke well. And many people just reported like that. Our symptoms that were being reported were like mild sore throat, little scratchy throat, runny nose. We had so many runny noses. If anything, coronavirus is a remedy for runny noses. So then the rest of the organ systems that we worked through were mind emotions. We have a number of those. Vertigo, eyes, ears, here, you can read all through those. And we didn't ask the question, did they have these symptoms previously? We only have during the single and the triple. So the rest of the organ systems are tallied here. And again, to review how it works is there are symptoms that appeared and some of them went away. So here we see in the vertigo single dose, there were actually a total of 13 symptoms that appeared, 10 of which went away. The one symptom above is what is cured. And so you can see that across the table. Now there's only two differences in this, and that is that the mind and sleep, and same with in the emotions and generals before, we catalog the symptoms as positive and negative. In the mind symptoms, there were 41 positive symptoms from the single dose and 19 from the triple dose. And there was a cumulative total of 57 symptoms, negative symptoms that appeared. It's a 1 week between the single and the triple dose. So within that 1 week frame, 27 of those original 57 disappeared. And then they took the triple dose. And so here there were 72 symptoms that developed, and within 2 weeks when they submitted the 2-week follow-up, 22 of those had resolved. Now, that is also what people wrote in the forms. Some people were clear and said for a few nights or a few days, or this lasted a few minutes, or but we're assuming that all of the negative symptoms went away as the person went through that process. But that's an assumption. And the same is true of the sleep. The single dose of the sleep, the 28 above were all the deep sleeps and prolonged sleeps and restful sleeps and that. And the 19 and 6, 25 below, the 25 appeared, and that was insomnia, restless sleep, difficulty sleeping, waking often, hard to get to sleep, and so on and so forth. But 19 of those negative symptoms we're calling went away. We understand that the excessive sleepiness and prolonged sleep was actually the body's attempt for a deep rest part. So that's that on this one. So that's how we're reading this. And this is a tally of the cured symptoms, and this is from, again, even though it was 796 people who responded, it was from those tallies that we said before how many symptoms there are. So these are our organs of affinity, and some verbs that we see repeated throughout. Sharp, sore, glassy. The bolded were more frequent, high-pitched. There's a lot of heat, flushed and dry. That's in many different organ systems. A lot of tight, stiff, blocked, plugged. That was also many organ systems. Once you see the symptom picture, the next case you're going to get, they're going to say 5 or 10 of these symptoms, and you're going to go, oh, it's time to give coronavirus nosode. Nausea, gagging, a lot of gastrointestinal symptoms, loose stools, nausea and vomiting, voluminous stools, many stools were being passed. And of course, we got all the lung symptoms, tightness, heaviness, pressure, burning, and then different kinds of restrictions. And sleep. Also, keeping in mind that we started this at the first lockdown. And so most people just lay around and slept all the time because they've been working 40 hours weeks, but their bodies were just craving the sleep, and they did that. There was such exhaustion, profound exhaustion, deep fatigue, these symptoms will come through. And if you have any case, and particularly with the post-COVID, you're going to see that intermittent symptom. By giving the remedy in water and having them sip it, it's going to heighten up their immune system, activate that fever process, and those intermittent symptoms are going to pass on through. So I did just a tally of these words. We found these words to be particularly essential to the remedy, and just this kind of irritating feeling, and then also burning that showed up 27 times throughout the word search that we did. These are some of the mental emotional symptoms that came forth. This is from the proving. So there's a lot of anxiety, irritability, fear, paranoia, heart palpitations, panicking, and the apathy and exhaustion, emotional sensitivity, tortured, feelings like that. And then what came to resolution was more immediate sense of peace, strength in the immune system, pleasant, energetic, increased libido, breakthrough. She expressed her aspirations. That would be a curative symptom. Yes, feeling of being connected to others, improvement of depression and brain fog, and just overall very positive experiences. Then on the mental function, one of the things that we noticed is anytime that we were working on the head or the headache symptoms, and we've got like several screens open at one time with different sheets of data and reading through, that our heads became locked in this kind of paralysis of not able to process through. And I don't know if I'm speaking for the group, but I just know as we're all trying to reconcile what's been happening through this epidemic, we're like, I don't understand. This just doesn't make sense. I can't make it make any sense. So I just want to say that this mental function severely improved, but these were some of the symptoms that were there. Racing thoughts, restless, fuzzy brain fog, like that. Felt like I was drunk. Some themes. I felt the collective emotions. Again, paralyzing fear, great sorrow, grief, profound sadness, and an out-of-control feeling. All of the symptoms went away within 24 hours after taking chamomilla. Well, we know that chamomilla doesn't cover any of those symptoms, so it must have been a wash through with the remedy. Profound peace, bliss, awareness, and the ability to ground collective emotions followed. I honestly feel like a different person. This nosode has changed me for the better. I feel really good after the remedy. Fear of the virus completely went. I felt optimistic, like the virus is here to help humanity transform. Feelings of elation and freedom, expansive energy, soaring. And here is one person's journey. I'm going to let you read that through. And a few dreams, daydreams. This brings to the conclusion part 2, and you can see from all of these dreams and the mental emotional state and resolution of acute that this remedy is touching on all levels of an individual. It's not just an immunological process. It's really a reconciliation process with the outer world and the inner world, and given the context of this epidemic that's affecting us around the world. So I'm hoping you will join us in part 3 of our coronavirus nosode research review, where we're looking at exposure, contraction, and long-term health outcomes. Free and Healthy Children International is a 501c3 nonprofit dedicated to research, education, and access to homeoprophylaxis. We advocate for healthy education of the immune system, freedom to choose healthcare options, unrestricted access to homeopathy and homeoprophylaxis. This is the cover of our long-term homeoprophylaxis study in children in North America, Part 1 and Part 2, Establishing Homeoprophylaxis as a Public Healthcare Model. It's a childhood immunization program covering 9 different diseases, starting with polio, streptococcus, whooping cough, pneumonia, tetanus, meningitis, Haemophilus, mumps, and measles.